Hi, I'm Dr. Bankson and I'm with the Vet on 4th, and today we're going to talk a little bit about pain management and how to know if your dog is in pain. My assistant Johnette is going to ask me a few questions to help you get a better understanding of when you might should bring your pet in and what might be safe to give.
Dr. Bankson, what is the difference between acute and chronic pain in dogs?
So acute pain is going to be something that happens really suddenly majority of the time and might last a couple of days. Chronic pain is going to be something that's a more long-term process, such as arthritis. It's going to be something that's going to affect your pet for more than just a couple of days, so weeks to months to possibly years.
How quickly should I bring my dog in if I suspect that they are in pain?
So you should bring your pet in anytime you suspect that they are in pain, as soon as you can get them to the veterinarian. So that way we can treat it as it is appropriately, whether that's non-steroidal anti-inflammatories or some other sort of anti-inflammatory medication, depending on what the diagnosis is.
What are some signs and symptoms of pain in my dog?
So the biggest one that we see or treat daily would be a patient that's limping or isn't using the leg very much. Some people may not think the dog is in pain because it's not crying or it's not whining, but even just not using the limb is a sign that your pet is uncomfortable, because they would use it if it was. Whining, crying, not wanting to get up and move around, those would be some other signs to watch for.
Are human pain pills like Tylenol or Advil okay to give my dog?
So no, those are typically not safe to give any animal that you have at home. It can cause some significant issues with liver or kidneys, and so we recommend not giving those to your pet.
What are some pain medications that we can give for my dog for pain management?
So we would recommend calling your veterinarian or us to be able to get that advice, or bringing your pet in for that, because we would prescribe medications for them based on their weight and what condition that they are experiencing. Typically, we will use NSAIDs such as carprofen, meloxicam, or sometimes steroids such as prednisone, depending on what we may diagnose.
Can a veterinarian help me manage my dog's chronic pain?
Yes, we can. And Dr. Gribble may talk a little bit about medication called Librela. That's a newer medication that we are using for a lot of chronic arthritis pain in patients. But there definitely are other options that are oral medications that we will use for chronic pain management. And sometimes we have to use multiple medications for those patients.
What can cause pain in my dog?
So we see anything from just a general soft tissue injury to cruciate ligament disease, arthritis, even things such as something getting stuck in their mouth or dental pain specifically. There are lots of things that can cause pain in our animal patients.
And do you always have to bring your dog into the vet to get these pain medications?
Yes, and it is advised to bring them in if they're in pain so we can know how to treat them appropriately, and we can get you a diagnosis so we know, is there something more underlying that's going on? Do they need a surgical procedure to fix whatever may have happened?
And for my last question, how will my veterinarian gauge whether my dog is actually in pain?
So we will use our physical exam, eyes, ears, hands, to be able to determine where the pain may be coming from. As well as the history that you give us of activity level of your pet, what may have changed with them. Those are our biggest diagnostic tools, other than next steps would be radiographs to determine what actually has happened in the pet. So those are the tools that we will typically use to diagnose pain in our patients. So if you have any further questions about this, please give us a call. We want you and your pet to be able to live more good years together.